This video has been created for Piedmont Family Practice LLC staff in a test patient environment. Today I will be showing you how to create, send, and find a future lab order. Elizabeth B. Boop, or Betty Boop, is going to be our test patient today. To send a future lab order, you must have an intake created. If you do not have an intake created, please do so now. Once you have that intake created, open up the PFP CW AP version 8. The version 5 will also work, but in this example, we'll be using the version 8. Over here on the top left, you'll see the button for future orders. Please ensure that you already have some sort of assessment and diagnosis code, which you can find down here. Or when we open up, click on the future lab orders, and you'll see your assessments. If you would like the future lab orders button in another area, please let Keith know, and he should be able to make that adjustment for you. Here we already have several future labs that we have set. Let's say we want to create another lab for diabetes. Click on it, which will highlight it, and it will associate it with that assessment. Come down to the next blank space, click on it, and select the desired test. If there is not a test on here that you would like, please let Keith know and he can add a test for you. We will be using the fecal occult blood test. Because it has selected the same interval, it has already added it for 1 week. If we unclick that, we can add a different one, glucose, and it'll ask us for the time interval, which you can set to any desired amount of time. Let's say 1 month. Okay. If you would like to add another diagnosis or would like to do something different, please click on the IMO or blue button. Here we have all their history of their different problems. You can also add from a problem list. Choose anemia. Click on the button to add, and now it's over here. Save and close. Now you can see we have anemia down here. Highlight that. 1 day. From here, you can set your requisition. In this example, we have the wrong signature on here, but that is something that will be corrected in the main area. So here we have our requisition, which you can print out to give to the patient, and they can use it at any time. They can come back in any of these intervals, which already has the date selected on when they're supposed to be coming back to make it easier for them. I'm going to save it, close, go back to the future orders. If you would like to task this off to your nurse or to any other member, task. I'm going to change the priority to normal. The subject is going to be a lab test, category lab. Save and close. No attachment. I'm going to send this to myself. Because I'm not a task member, it's not going to allow me to send it to myself. Otherwise, if you had someone else, it would allow you to add. You would hit OK and send as normal. We're going to cancel because I don't want it sent anywhere. Exit out. Now, when the patient comes back in at any time, you can go over to Categories, Future Orders, open up, and here's our future order. It says the 6/13, although that is not today's date. But that is when it is shown because that is the date of the intake. Now they can find it any time. Please let me know if you have any other questions.